What is cefuroxime? Cefuroxime belongs to the cephalosporin class of antibiotics, specifically classified as a second-generation cephalosporin. It was approved by the U.S. Food and Drug Administration (FDA) in December 1987. Unlike first-generation cephalosporins, second-generation versions like cefuroxime have enhanced activity against gram-negative bacteria while still maintaining effectiveness against gram-positive bacteria. Cefuroxime is also more resistant to beta-lactamase enzymes, which are produced by certain bacteria to resist antibiotic effects. The medication is available in several forms. Oral tablets, 250 mg and 500 mg. Oral suspension, 125 mg per 5 ml and 250 mg per 5 ml. Injectable solution, 750 mg, 1.5 g, and 7.5 g vials. Cefuroxime Axtil is the oral prodrug form of cefuroxime, designed to enhance absorption when taken by mouth. What are the benefits and uses of cefuroxime? Cefuroxime is a broad-spectrum antibiotic used to treat various bacterial infections throughout the body. Its effectiveness against both gram-positive and gram-negative bacteria makes it a versatile treatment option for many common infections. Conditions cefuroxime treats. Cefuroxime is commonly used to treat respiratory tract infections, bronchitis, pneumonia, laryngitis, ear infections, otitis media, sinus infections, throat and tonsil infections, urinary tract infections, skin and soft tissue infections, gonorrhea, sexually transmitted infection, early Lyme disease, meningitis, infection of the membranes surrounding the brain and spinal cord, bone and joint infections, chronic obstructive pulmonary disease, COPD, exacerbations. Secondary uses of cefuroxime. Cefuroxime is also used off-label for intra-abdominal infections, antimicrobial prophylaxis during surgery, odontogenic infections, tooth-related. How does cefuroxime work? Cefuroxime, like other beta-lactam antibiotics, works by preventing bacteria from forming their cell walls, which are essential for bacterial survival and reproduction. Cefuroxime mechanism of action includes binding to specific penicillin-binding proteins, PBPs, located inside the bacterial cell wall. Inhibiting the cross-linking of peptidoglycan, an essential component of bacterial cell walls. Weakening the cell wall structure, making it unstable. Causing bacterial cell lysis, rupture, and death. Cefuroxime has activity even in the presence of some beta-lactamase enzymes, both penicillinases and cephalosporinases, that certain bacteria produce to resist antibiotics. This makes it effective against many resistant strains that might not respond to other antibiotics. How to take cefuroxime. Cefuroxime is available in tablet and liquid forms. It is typically taken every 12 hours for 5 to 10 days, depending on the severity of the infection. For gonorrhea, a single dose is often sufficient. Lyme disease may require tablets every 12 hours for 20 days. Take tablets at the same time each day to maintain consistency. Follow the dosage instructions on the prescription label. Consult your doctor for guidance on how to take the medication effectively. Cefuroxime dosage. Cefuroxime dosage depends on the type and severity of infection, the patient's age, weight, and kidney function. Always follow your doctor's specific instructions when taking this medication. Typical dosage instructions. For adults and adolescents, oral tablets. Most infections, 250 to 500 mg twice daily for 10 days. Gonorrhea, single 1 gram dose. Lyme disease, 500 mg twice daily for 20 days. For children, oral suspension. Children 3 months to 12 years, 20 to 30 mg per kg of body weight per day, divided into 2 doses, for 10 days, not exceeding 1,000 mg daily. Infants under 3 months, dosage must be determined by a doctor. For injectable cefuroxime. Adults, 750 mg to 1.5 g every 8 hours, depending on infection severity. Children, 50 to 100 mg/kg/day divided into 3 or 4 doses. What should I do if I miss a dose? If you miss a dose, take it as soon as you remember. However, if it's almost time for your next scheduled dose, skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to make up for a missed one. If you're unsure, consult your healthcare provider for guidance. What happens if an overdose? An overdose of cefuroxime can have harmful effects on bodily functions. Symptoms may include seizures, unusual bleeding or bruising, and severe stomach pain. If you suspect an overdose, seek emergency medical attention immediately or call a poison control center. Get a second opinion from trusted experts and make confident, informed decisions. Get second opinion. What are the side effects of cefuroxime? While cefuroxime is generally well tolerated, it can cause side effects in some people. Understanding these potential effects can help you recognize when medical attention may be needed. Common side effects. The most common side effects of cefuroxime include nausea, vomiting, diarrhea. Serious side effects may include rash, itching, hives, difficulty breathing or swallowing, wheezing, swelling of the face and throat. Your health is everything. Prioritize your well-being today. Schedule appointments. Schedule your appointment. Precautions and warnings. Before starting cefuroxime, it's important to understand who should avoid it, when to exercise caution, and how food or alcohol might interact with the medication. Who should avoid this medicine? Individuals allergic to cefuroxime, other cephalosporins, or penicillin. Patients who have had severe allergic reactions to antibiotics in the past. Those with known hypersensitivity to any component of the formulation. Conditions where caution is needed. Kidney, intestinal, or liver disease. Cefuroxime may accumulate in the body if kidney function is impaired. Poor nutrition or malnourishment may affect drug absorption and tolerance. History of gastrointestinal issues like colitis should be reported to the doctor. Elderly patients may be more sensitive to side effects like dizziness or confusion. Allergy warnings and serious health conditions. Be aware of allergic reactions such as hives, trouble breathing, and facial swelling. These symptoms require immediate medical attention. For individuals with kidney issues, higher levels of cefuroxime may accumulate due to reduced kidney function, increasing the risk of side effects. Breastfeeding individuals should weigh the risks and benefits with their healthcare provider, as cefuroxime can pass into breast milk. Before taking cefuroxime, inform your doctor about any other medications you're currently taking. Some inactive ingredients in cefuroxime can cause allergic reactions or other issues. Cefuroxime can also cause dizziness and drowsiness, so caution should be taken when performing activities that require alertness, such as driving. Are there any age restrictions for using cefuroxime? Yes. Cefuroxime should be used with caution in children under 3 months old. Pediatric patients are often prescribed cefuroxime syrup, which is specially formulated for easier dosing. Always follow your doctor's guidance when giving cefuroxime to children or elderly patients. Alcohol or food interactions. Avoid excessive alcohol consumption while on cefuroxime. Alcohol can increase dizziness and may interfere with the medication's effectiveness. It is best to take cefuroxime with food to enhance absorption and reduce stomach upset. Possible interactions with other medications. Drug interactions. Cefuroxime may interact with other medications, potentially affecting their effectiveness or increasing the risk of side effects. Important drug interactions include probenecid can increase blood levels of cefuroxime by reducing its elimination through the kidneys. Warfarin and other anticoagulants may increase the risk of bleeding. Aminoglycosides, such as gentamicin, may increase the risk of kidney damage. Nephrotoxic drugs may increase the risk of kidney problems. Highly protein-bound drugs, such as phenytoin or aspirin, may be displaced from binding sites, potentially increasing their effects. Immune checkpoint inhibitors. Cefuroxime may interfere with their therapeutic effects. Always inform your healthcare provider about all medications you are taking, including prescription drugs, over-the-counter medicines, vitamins, and herbal supplements. How should cefuroxime be stored? Proper storage of cefuroxime helps maintain its effectiveness and safety throughout its shelf life. Recommended storage temperature for cefuroxime. Cefuroxime tablets should be stored at room temperature, between 68° F to 77° F, 20° C to 25° C. It can be exposed to temperatures between 59° F to 86° F, 15° C to 30° C, for shorter periods, such as during transport. For the oral suspension, after reconstitution, it should be kept refrigerated between 36° F to 46° F, 2° C to 8° C, and used within 10 days. Shake well before each use. What happens if cefuroxime is not stored properly? Improper storage can lead to degradation of the medication, potentially reducing its effectiveness or causing it to become harmful. Exposure to heat, moisture, or direct sunlight can accelerate this degradation process. Always keep cefuroxime in its original container, tightly closed, and away from children and pets. Do not use cefuroxime after the expiration date printed on the package. Remember to consult your healthcare provider with any questions or concerns about cefuroxime. Always complete the full course of antibiotics as prescribed, even if you start feeling better before finishing the medication, to ensure the infection is completely eliminated and to prevent antibiotic resistance.